Good morning, everyone. Can we try that again? Good morning, everyone. Good morning. So much better. Thank you. It's my pleasure to welcome you today as we celebrate the accomplishments of our School of Health Professions students. Today is about more than completing a program. It's about recognizing the dedication, resilience, compassion, and hard work that brought each student to this moment. Our students have balanced rigorous coursework, clinical experiences, personal responsibilities, and the challenges that come with preparing for a career in healthcare. They've developed the skills of their professions while also learning the importance of teamwork, communication, professionalism, and patient-centered care. Today we celebrate what they have accomplished and the differences that they prepared to make for patients, families, and communities. We are also grateful for the support that makes this work possible. I would like to thank the Board of Trustees, including our board chair, Joan Medeiros, and several of our Board of Trustees members that are here with us today, for their continued commitment to our students, our programs, and the mission of Bristol Community College. I would also like to thank President Harris, who's also with us, for his commitment and his leadership for continued support of the School of Health Professions. I would also like to recognize the faculty members who are celebrating different milestones for their work anniversaries here with the college. Behind me, we have all of our faculty that were able to join us today within all of our programs. They're also listed in your program. Today, we have several faculty with work milestones. Their commitment to our students, programs, in Bristol Community College is deeply appreciated. Please join me in congratulating Vicki Revier for 20 years, Dr. Debbie Cuenga for 15 years, Dr. Connie Messier for 15 years, Hilda Magalese for 10 years, and Heidi Martin for 10 years. Thank you for your continued commitment and service. Today is a joyful day for our graduates, their families, our faculty, and our entire Bristol community. We are proud of our students, proud of the work they've done, and excited for the future they are stepping into. At this time, it's my honor to introduce someone whose leadership and support continue to strengthen our college and the opportunities available to our students. Please join me in welcoming our president, Dr. Cedric Harris.
Thank you.
You're welcome.
Well, since she's already given you the opportunity to say good morning the right way, we're going to go ahead and jump right into the remarks. But before doing that, I do want to share really quickly the importance of today. This is an opportunity for us to celebrate the hard work and dedication of these students. And what they are about to embark upon is a great deal of something that we enjoy here at Bristol, which I have considered and coined the Bristol Advantage. Before getting into the remarks as well, I'd like to once again introduce some important people to the college, for the work that they do, unwavering commitment that they've had to this organization and institution for zero pay. So let me once again introduce Board Chair Joan Medeiros, Trustee Tony Lima, and Trustee Renee Clark. Thank you all for being here today. By a show of hands, how many people have graced our campus once before? You've been on this campus once before. Students, keep your hands down. You belong here. You belong here. Once again, raise them high. You've been here before. Okay, all right. So for those who have been here before, welcome back. For those who have not come to our campus before, welcome. Welcome to Bristol Community College. And as stated before, I'm the proud fifth president of Bristol Community College. And I hope to thank you. I wasn't expecting that. We hope to celebrate and congratulate our students as well as the families today. Today is a day of celebration of the hard work and dedication. It is also a moment to look ahead, but also give each and every one of you students the permission to dream big and think about what comes next. Take a time to reflect on your future and what you're going to do with it. What are you going to build? You've chosen the pathway of healthcare, a field that grows and continues to grow in high demand, and it is deeply, deeply meaningful. Every day in hospitals and clinics, we see Bristol students, Bristol graduates that are making a difference, and now it's your turn to join them. You know, as you step into the workforce, it's going to be really important for you to carry more than just a degree you'll receive tomorrow. You're going to be bringing into the workforce skills, your compassion, as well as all of your ambition. It is time to dream big, folks. We challenge you. We challenge you to think about what you want to do, where you want to go, and what you want to become. But let's think about how you got here, what it took, because none of you got here alone. Along the way, you had people supporting you, many of these people sitting behind you, supporting you along the way. So students, let's take a moment to salute those who supported you. Some of these faces behind me, I'm sure some of you recognize. During test times and exam periods, you probably despise them. You're like, I don't deal with these people. But let me tell you, they're some of the best. Highly respected, highly decorated. These are the professionals that made the pathway for you, inspired you on your journey. Most importantly, as I close my remarks, you heard me say it earlier, is dream big. It's important to dream big. Dream big on things that are absolutely possible for your career and what you plan to build from this point forward. You know, these are moments for me that are very proud, and it reminds me of why I work at the community college. 28 years of working at a community college, it has not been one time that I wasn't grateful for these opportunities, and leading this institution has been a mark on my career. Standing in front of you, the one thing I can say is that I, several years ago, were just like you. Because if you come to my office, you will not find that doctorate degree hanging on the wall. You will not find that master's degree hanging on the wall. You will not find the bachelor's degree sitting on the table. But what you will see hanging high on my wall is my degree from Southwestern Michigan College, because I, too, am a community college graduate. So congratulations, students. Congratulations for all the hard work and dedication. Thank you for your commitment, your selfless service, and answering the call that puts all of us before yourself. So allow me at this time to welcome Marie Kamarski to the stage for continued remarks. Thank you.
Thank you, Dr. Harris. And again, welcome everybody. My name is Marie Kaczmarski, and most of you have worked with me in one capacity or another over the past few years, and I'm a coordinator within the School of Health Professions. I do want to take a moment and honor one of our faculty member and correct the years that she's been with us, Dr. Debbie Kwenga. Deborah Kwenga has been one of our nursing faculty members for not 15, but actually 20 years. So she's celebrating that milestone with us, and we're very honored to be able to celebrate that with her. Healthcare is never the work of one person or of one particular profession. It is built through the connection between many roles, each bringing a different skill, a different perspective, and a different responsibility to the care of the patient. Across the School of Health Professions, our students are preparing to enter fields that are deeply connected. A patient's care may involve a medical assistant helping prepare and support them during a visit. an EKG technician performing cardiac testing that provides important information about heart function, a phlebotomist collecting specimens with skill and compassion, a medical laboratory technician then producing the results that will help guide, inform diagnosis and treatment of that patient. That same patient may also be cared for by a nurse providing assessment, education, advocacy, and coordination of care. A dental hygienist recognizing oral health concerns that connect overall wellness, or an occupational therapy assistant helping the patient regain the skills and regain the confidence needed for daily life. Each role is unique and distinct, but none stand alone. Excellent patient care depends on communication, on accuracy, compassion, professionalism, and overall respect across the entire healthcare team for each other and, of course, for the patient. Our programs may teach different skills, but they are united by the same purpose: preparing students to care for people with knowledge, integrity, and humanity. With that shared purpose in mind, we're proud to introduce the School of Health Professions Hawkeye Award for Clinical Excellence. This award is presented to one student in each program nominated by faculty in that particular program, identifying a student that has demonstrated outstanding clinical performance, professionalism, and commitment, patient-centered care. Today, we're going to be recognizing students from each of our programs with that in mind, and tell you a little bit about why these particular students have stood out in the clinical setting and represent not only excellence in their individual programs, but to the collaborative spirit of the School of Health Professions. With our Occupational Therapy Assistant program, the student that's being honored in this program stands out first and foremost for her genuine kindness, eagerness to help others throughout her clinical day. Her focus is always on how she can support patients, assist her coworkers, and make herself useful in meaningful ways. She demonstrates this in both small and significant moments, making sure that patients are comfortable, that patients have access to what they need, and feel cared for before a therapy session ends. She willingly steps in to support coworkers, whether that means assisting with a wheelchair, helping during treatment session, or simply being an extra set of hands. Rather than holding back, she consistently looks for new ways to be engaged, helpful, and impactful. Her kindness is one of her greatest strengths. She treats patients with dignity, respect, patience, and warmth. Her tone, encouragement, and presence have made a lasting impression for the people she cares for, many of whom look forward to working with her. She also brings that same respect and positivity to her coworkers, making a point to greet others, say goodbye, and create an overall positive presence in the clinical environment. Clinically, she shows strong initiative, confidence, and flexibility. Her background as a CNA has helped her develop strong skills in setting up and supporting activities of daily living. She is goal-driven, appropriately challenging, able to adjust plans to communicate clearly, ask thoughtful questions, and seek feedback in a way that reflects maturity and readiness for practice. This student has the qualities that make an excellent occupational therapy practitioner: kindness, professionalism, clinical curiosity, confidence, and a greater genuine desire to help patients feel supported and capable. Her patients will be fortunate to experience the care, encouragement, and positivity she brings to this profession. It is our pleasure today to welcome and acknowledge for the Occupational Therapy Assistant recipient of the Hawkeye Award for Clinical Excellence. Khadija, I'm looking for the last name. Khadija Diamani. This year's Hawkeye Award for Clinical Excellence in Medical Laboratory Technology is being presented to a student who represents the very best of the profession, compassion, and clinical excellence. This student is wonderfully dedicated, consistently strives for excellence. She supports her peers, often staying late into the evening to work with study groups. She brings a calm, reassuring presence to every setting that she enters. During clinical, she had a meaningful interaction with a patient diagnosed with hemochromatosis and thalassemia. Thank you. While waiting during the patient's treatment process, she remained with him and used that time to engage in a thoughtful, educational, and patient-centered conversation about his diagnosis and his care. She connected what she had learned in hematology, blood bank, phlebotomy, to the real experience in front of her and the real patient in front of her. Understanding how lab values directly influence treatment decisions and patient safety. Her professionalism, communication skills, and ability to ask insightful questions were so impressive that the therapeutic phlebotomist commended her to the blood bank supervisor. For an MLT student whose patient interaction is often limited, this level of recognition is truly exceptional. This student represents the very best of clinical excellence. She is academically strong, deeply compassionate, and already demonstrating the kind of professionalism that will make a lasting impact on her future patients and colleagues. It is my pleasure to present the Hawkeye Award for Clinical Excellence for Medical Laboratory Technology to Angelina Andrade. The Hawkeye Award for Clinical Excellence for Medical Assisting. The student nominated for medical assisting is one that was not sure she would be able to make it here today. A student that doubted herself on many occasions. She has persevered and proven herself to be a medical assistant. During her clinical, on her first day rooming patients on her own, she encountered an individual undergoing a mental health crisis. She remained calm with the patient, acting quickly, notifying providers immediately. Sometimes students don't see what faculty do. An individual with compassion, knowledge, and skills to make a difference in the healthcare world. The 2026 Hawkeye Award for Clinical Excellence recipient is Marina Shippey. Marina will continue to make the Bristol Medical Assisting Program proud in all of her future endeavors. Go to nursing next. Go to nursing next. The Clinical Excellence Award for the nursing program. From her very beginning of her clinical experience, this student demonstrated a level of critical thinking and situational awareness well beyond that of a typical nursing student. She consistently asked thoughtful and clinical relevant questions, actively sought to understand the why behind patient care decisions, and was able to synthesize complex clinical information into meaningful assessments and interventions. Her ability to connect concepts and apply them in real time reflected both intellectual curiosity and a genuine passion for nursing. What stood out most was her exceptional attention to detail and strong patient advocacy. During one clinical shift, the student identified that an intravenous antibiotic infusion prepared during the prior shift had never been connected to the patient and instead infused on the floor. She immediately recognized the issue, notified her clinical instructor promptly, and appropriately followed the chain of command, informing the assigned nurse. Her vigilance and professionalism in that moment demonstrated maturity, accountability, and a patient safety mindset that is often seen in highly experienced nurses rather than students. Beyond her clinical competence, she consistently went above and beyond for her patients and colleagues alike, approached every patient interaction with compassion, professionalism, and a sincere desire to provide the highest level of care possible. This student represents the qualities that define nursing excellence, and I have no doubt that she will be an outstanding registered nurse and future leader within the profession. The Hawkeye Award for Clinical Excellence for Nursing is awarded to Monica Santos. The Hawkeye Award for Clinical Excellence for the Dental Hygiene Program is a student receiving this award in recognition of their commitment to excellence in patient care and teamwork. Their leadership, positive attitude, and ability to support and inspire others have made a lasting impact on both peers and their faculty. This year's recipient is Stephanie DeMello. Thank you very much. We will now be introducing the programs to begin the pinning of the honorees. I'd like to welcome to the stage the program chair of our Occupational Therapy Assistant Program, Dr. Connie Messier.
Thank you, and I am honored to be here and so happy for these students to be receiving their pin, which is a symbolic step into the profession. Bristol OTA's program advances the mission of the college by providing an accessible, innovative, and inclusive education that prepares students to enter the workforce as an entry-level practitioner. Occupational therapy enables people of all ages to participate in daily living. Occupational therapy practitioners focus on what is important to the client and use of everyday activities, occupations, to promote health and well-being. Occupational therapy assistants, also known as OTAs, and when they are certified, COTAs, COTAs, work with individuals across the lifespan in a variety of settings in healthcare and in the community. Bristol Community College's OTA program has prepared these 7 students today to support their community and fulfill their dream to become a professional, competent, and respected occupational therapy assistant. Thank you. Dorothy Chase will read the names.
If the occupational therapy students could please rise and walk to stage right. our first occupational therapy assistant student, Christine Delamita. Khadija Dihamani. Emily Mary Guthrie. Lindsay Lafib. Jenna Maxim. Julie Webster. I'd like to welcome to the stage Dr. Kelly Hiller to tell you a little bit about medical lab technology.
Hello. I'm going to talk about both medical laboratory technology and phlebotomy because we are all part of the same team. I'm going to start with a story. So in 2005, and I promise it's related, a man named Matt decided he was tired of simply moving from one phase of life to the next. So he was looking for something more meaningful. He set out to travel the world and basically recorded himself dancing in random countries and random places. From that simple idea, where the heck is Matt, since we have a mixed company today, was born. Over the next decade, people from around the world will join him in on his videos. Without intending to, he touched countless lives and created moments of joy and connection across many different cultures. One small video brought people together across the globe that he could not have even imagined. So in a lot of the same ways, laboratory science itself also creates connections that often go unseen but have a huge impact on patients' lives across the world. So medical laboratory technology is a vital health profession, and it's dedicated to providing clinical laboratory information and services that are essential for diagnosis, treatment, and prevention of disease. Everything that everybody else in this audience is going to have an involvement in. More than 70% of all medical decisions are based off of laboratory data alone. So any of the treatments, the diagnoses, anything that patients are receiving, 70% of the time or more are from laboratory data. And so our laboratory technicians and our phlebotomists play a vital role in providing that care to these patients. So the effort here starts with the expertise of our phlebotomists. They serve as the front line of laboratory skills. They collect our specimens, ensuring patient identity, specimen integrity, and patient safety. Their work sets the foundation for accurate and testing and meaningful diagnostic outcomes. Our phlebotomy graduates enter the healthcare field ready to support their patients and ensure safe and accurate results. Medical laboratory technologists provide a vast array of lab tests. They uphold rigorous standards of quality, interpret the significance of test results, evaluate new methodologies, and assess the effectiveness of all their laboratory practices. Their expertise is critical in transforming the raw data into actionable medical insights. This year's graduating class holds a special place in our hearts, and we're incredibly proud of their achievement, including our Curriculum Award recipients, Angelina, Lindsay, Michelle, and Marquise. For medical laboratory technology. I'm almost done. And our first department award that we have ever given, and it's our Department Perseverance Award to Kylena Dillard for her determination and exemplary effort to learn. From their support of one another to their late nights in J, which you've heard at numerous occasions now, getting kicked out at the end of the night. They have to go home because it's closing. This group of students across the board, medical laboratory technology and phlebotomy, exemplifies what it means to be a Bristol student and will provide the greatest of care to their patients.
If the medical lab technician students could please rise and come to stage right. And we will start with Angelina Maria Andrade. Lindsay Lee Chubbuck. Kalina Mylin Dillard. No hugs. Michelle Trang Garland. Lily Goulart. Stephanie Rodriguez. Marquis Texera. Gianni DeBarros. Yeah, we're all set. No, our next group is EKG. Our next person to the podium will be, no, I know, but where's the speech? The next person to the podium will be our faculty member and department chair for EKG technician program, Angela. It's okay.
Surprise, I'm back. So the electrocardiography certificate students have much to be proud of. The skills they have learned, including taking vital signs, performing accurate EKGs, placing 24-hour cardiac monitors, and setting up stress tests, they have the knowledge and understanding of how to interpret the EKG tracings and how to identify both normal and abnormal rhythms. For some, this is just the beginning of their healthcare career. For others, the EKG certificate program was a way to enhance and build their skills and continue in their journey. Congratulations to the EKG graduates.
If our EKG students could please rise and move to stage left, that would be great. Sarah Cherry. Jennifer Carrero. Veronica Costa. Janelis Rivera. Dakota Rose Tessier. Do you have a speech for Emma? Our next group of pinned students will be medical assisting, Okay. Dr. Kelly Hiller will read a little bit about medical assisting before we do our pinning. Should I tell them you can't read the small type?
Yeah, I got it.
All right. Yeah, go ahead and just say that about.
It's because I have glasses on. I might have to one-eye this one. Many ask, what is a medical assistant? She or he can be the professional who checks you in at your primary care doctor's appointment, or the clinician who takes your vital signs at the walk-in, or the proficient clerk who manages your billing. Here at Bristol, medical assisting students learn medical terminology, record keeping, patient scheduling, and billing. They learn many clinical skills from taking blood pressure and vital signs to EKGs, blood drawing, giving medications, and many important procedures. They especially focus on patient education and how to share their valuable insights with their patients. The important skills our students also possess, compassion, empathy, and exemplary communication, are skills that are so necessary in healthcare today. Once again, congratulations to our rising stars in medical assisting. You've done amazing work. We are so proud of you, and we know you are bound for success.
Angela doesn't have her glasses on. That's why she didn't do the reading. So Angela Thibault, in the green flower dress, is our program chair for medical assisting and does all the teaching in medical assisting. So if our medical assisting students could please rise. Trinity Annuncio. Emma Fontaine. Sarah Grinnell. Vanessa McLean. Marina Shippey. I would like to welcome to the stage our dental hygiene chair, Sarah Williamson. You have yours. Perfect.
Hello. Our dental hygiene students have spent the last 2 years strengthening their clinical competence, refining patient communication skills, and developing a deeper understanding of the relationship between oral health and systemic health. Collectively, you've provided countless hours of dental hygiene care to members of our community in our school-based dental hygiene clinic on campus. The contribution is both meaningful and commendable. May the ethical foundation that you've built here at Bristol continue to guide your professional practice. May you remain committed to lifelong learning. Continue your clinical growth with the highest standard of professionalism and patient-centered care. Today, in recognition of your academic achievement and clinical readiness, each graduating student will receive their dental hygiene pin. This pin symbolizes and represents your transition from student to professional, and symbolizes your entry into the dental hygiene profession. On behalf of the Dental Hygiene Department, it is my privilege to invite Dr. Chase back up to announce the names of our graduates as Dr. McGower and I present each student with their pin. Thank you.
If the dental students could please stand. Sarah Josephine Armstrong. Michaela Ann Bushell. Stephanie DeMello. Kaylee Marie DiMedeiros. Renee Duffy. Jessica A. Elisier. Kylie Eleanor Fonts. Melissa R. Frias. Christina Danielle Halliday. Julia Lembo. Brianna Marie Lopes. Gracie Adila Maloney. Bethany L. McLaughlin. Leila Maria Nascimento. Gabriela de Oliveira Palmiera. Did I do okay, Gabby? All right. Molly Elizabeth Perry. Grace Catherine Riley. Haley Tangway. I would like to welcome our phlebotomy students to please rise and come to stage right. Hafsa Adenane. Mallory Baker. Courtney Berry. Josephina Lopez Brown. Lissy Lisette Centino. Sandy DeAndrande. Ann Esterveen. Madison Faria. Janelle Farrow. Skyla Jones. Emily Kang. Lindsay E. Knox. Faith Lee Landreville. Catherine E. Lever. Jennifer C. Nunez de Oliveira. Stephanie Pimentel. Dianera Rivas. Ileana Marie Rivera. Janice Monteiro Silva. Tyes Ventura. I don't have another name checked. Ashley Tillman. Okay. Our last group of students that we will be pinning this morning are our nursing students. And they're obviously the loudest right now. Nursing, as everyone knows, is near and dear to my heart. I've been a nurse for 30, I don't want to say years. And I tell everyone I've been a nurse that long. It's okay. I'm okay with my age. As everyone knows, nursing is not what you see on TV. It's not The Pit. It's not Grey's Anatomy. There's a lot of things that we do as a nurse. You get a small touch of what a nurse is in your nursing program, and nursing is so much more. We've given you a groundwork and a framework so that when you graduate, you can become a nurse and you can choose your path. The path that we started with as nurses on this stage to become educators is not necessarily the nurse we started as, nor the path that we ended up in. And that's okay. Each of you are going to become the nurse you want, and you'll become who knows what after tomorrow in graduating and after you take your NCLEX. If you ever need support or need help in deciding what you want to be next, come back and talk to any of us. Nurses touch in every aspect of the healthcare world, from just checking a blood sugar to a blood pressure, to making an assessment on what those findings may have been. As Dr. Hiller explained, we look at those clinical labs and those medical labs that have been done, those values that were drawn by the phlebotomist, and make determinations on what that care is going to look like based on those blood values. We help give that information to our dental hygiene people to say, you know what, maybe they shouldn't have those teeth cleaned because of their medical background. They have cardiac disease or they have other things going on in their lives that maybe having their teeth cleaned isn't the right move. Nurses touch so many different avenues. We work with every single health profession, and communication is key. We hope that we've given the students here that groundwork and those things so that they can become the best professionals possible. I'd like to welcome our nursing students to come forward and join the profession of nursing. If I could have the first line stand and move to the right.
Haley Aguiar. Monica Almaguer Nunes. Paige Almeida. Jocelyn Alvarado. Chanel Andrade. Chloe Bashand. Jamie Betancourt. Wendy Amaral. Jade Botello. Haley Braband. Chelsea Canary. Elizabeth Carota. Fran Chapin. Janie Chenard. Nathan Chubb. Cami Cuoto. Allison Curtin. Amari Duarte. Carrie Ann Ferreira. Tatiana Francois. Roberto Alvarez Gonzalez IV. Patrick Griffin. Ashley Hatch. Tara Hawes. Adewale Johnson. Carol Casita. Kim Laubenstein. Rachel King. Cladimira Resendez Santos Lido. And baby. Ariana Linhars. Sammy Mena. Brianna Martinez. Erica Massa. Cindy McCormick. Ashley McGordy. Jane Mene. Ashley Mercier. Kirsten O'Brien. Jaylene Perez. Tatiana Pike. Wendy Raposa. Samantha Rigo. Angela Rito. Amber Rosignol. Samaya Rokuz. Valerie Ruano. Monica Santos. Jessica Silva. Lindanalva Silva Lima. Natalia St. Germain. Emma Grace Therian. Ashley Trenholm. Esther Tripp. And our last pinning honoree today at our celebration is Hannah Vigas.
Yes, but I'm not there yet. I'm gonna do the ethics pledge, and then you can come and help with these. I would like to have all of our honorees that were just pinned stand up. They're like, oh gosh, we're gonna do some calisthenics. In every single profession, being an ethical provider is an extraordinarily important thing. What we're gonna do now is just take a moment and say an ethics pledge. So I'm not gonna have you read the ethics pledge. It is on your program, but instead I'm going to read it by paragraph, and after each paragraph I'm gonna pause and have you say the same thing you say when you get married. I do, so that you agree with the ethics pledge that we're reading. Are you ready? Okay. So as I said, in all medical professions, we make a solemn commitment to uphold the highest of ethical standards. Many are familiar with the Hippocratic Oath. That's one of the oldest and most enduring expressions of medical ethics in the Western world. So we are going to talk about the sacred responsibility of caring for the sick and the importance of ethical conduct in the healing professions. So, this is the ethics pledge that we've chosen here at Bristol. In full knowledge of the obligations I am undertaking, I promise to care for those I am responsible for with all the skills and understanding I possess, without regard to race, creed, color, politics, social status, sparing no effort to conserve life, to alleviate suffering, and to promote health. I will respect at all times the dignity and religious beliefs of all patients under my care, holding in confidence all personal information entrusted to me, and refraining from any action that might endanger life or health. I will keep my professional knowledge and skill at the highest level and give loyal support and cooperation to all members of the healthcare team. I will do my utmost to honor the code of ethics and uphold the integrity of my chosen profession. Thank you. You can all sit. Before we finalize this ceremony, I would like to take a few moments. We have a few faculty who have also graduated in different programs. So I'd like to take a few minutes to not only thank our faculty, but also congratulate our graduating faculty. So we have a faculty member in our occupational therapy assistant program who has now become Dr. Sandra Cousins. Sandra? I'd also like to take a minute to congratulate Professor Kyle Leonard on his graduation ceremony that happened last night. Yeah, he's the big guy. Kyle just joined our faculty this past January, along with one of our other nursing faculty, Beth Miller. We also have a faculty in our EKG department who is not here today that just finished her degree as well, and that's Lucy Vieira. She's not here, but we will celebrate with her soon. I would also like to take a minute to thank two very important people who are in our department who do an unbelievable amount of support and assistance that keep my right hand and my left hand working, and also keep the tenor and tone of our office just moving forward, and that is Marie Kaczmarski and Deb Dion. I don't know where Deb is. Come on out, Deb. She did not know. I didn't know. Thank you. I told each of them respective of the other, so neither of them knew the other was getting something. So anyway, I want to thank everyone for coming here today. We do have a small gift for each of the students, and we would like you to exit out the same way you came in, so opposite sides. So you're going to go out first, and we'd like our students to exit first. There's going to be some music that comes on, and then we will meet anybody out in the foyer. If you'd like photos with your faculty or anything, the faculty will also exit out. So please, we're going to have you go out one aisle at a time, please, and wait for the processional music. And I want to thank everyone for coming today, and we look forward to having all of you be successful moving forward in your chosen profession. Thank you so much.